I think most families know, and certainly all doctors know, that there is more respiratory disease in children in the winter. This is because there's more respiratory viruses that circulate in the winter, and certainly the biggest troublemakers are RSV and influenza, which we have known about for literally decades. I think what families should do is what they've always done. I think that when people are not feeling well, they should not go to work and not go to school. I think that washing your hands or hand hygiene is important to slow the spread of infection. I think that everyone who is permitted to do so should get an influenza vaccine, which is just about everybody, excluding young infants, for example. And I think there's a lot of people who are worried about COVID-19, and I think those people should get a booster as well, because that is something that everyone can do to protect themselves against severe disease. Most viral illnesses have no specific treatment. So when your child is sick, what I think one should do is just try to make sure that they're drinking enough liquids. You can treat their fever with antipyretics such as acetaminophen or ibuprofen. Try to keep them as comfortable as possible. If anyone thinks that their child is having difficulty breathing, not getting enough air, they absolutely need to be taken to the emerge. If a child is not drinking enough, and parents can know this if they notice that their child is not peeing enough, then they absolutely need to be taken to the emergency department. And one other thing that I would generally say, if a child has very many days of fever, and normally we're talking like more than 5 days of fever, then in many cases, a child like that should be taken to see a clinician. So I don't want to get into trouble with my mom or anyone else's parent, right? But no, being cold does not give someone a viral illness. So it is unfortunate that those words are the same, but I think there's lots of good reasons to wear your jacket in the winter, but that in and of itself will not predispose one to developing a respiratory infection.